Nurse aides work with your loved ones daily at skilled nursing homes, helping them eat and get dressed. If an aide gets caught neglecting or abusing a senior, they can be put on a CNA abuse list in North Dakota. All states have similar lists. In North Dakota, it has names, types of abuse committed like sexual, physical, and theft.
Each state has a little different method of making that same type of information available to their skilled nursing facilities.
Bruce Pritchett oversees the list in North Dakota. He says the list was started in the 1990s and people are only placed on the list if found guilty.
Most of them are health department investigations. Some of them are police, especially the theft.
On the CNA abuse list that we printed out for North Dakota, we found that there were 59 physical abuse cases, 47 cases of neglect, 52 thefts, along with 33 verbal, 30 mental, and 6 sexual abuse cases. Pritchett says people can challenge their name going on the list. Once your name is on the list for abuse, it is there for life. But there is one exception: neglect.
You purposely aren't answering their call bell, or you're purposely neglecting to do something.
He says that is the one form of abuse that can be removed from the list.
We validate the neglect. They go on the registry. They have to be on there at least a year. Okay. They go on the abuse list. After a year, they're eligible to petition the health department to have their name removed from that list. Not all of them succeed in getting their name removed. Most of them do.
Why is there that option allowed?
If they commit it a second time, then they do not get to remove it. Neglect was something that can be very simple. I mean, you may forget to put socks on the resident as you're getting them up to go to the bathroom, and they may slip. There's a lot of things to know, and it's very difficult to prove that they willfully did it. So in that light, and the fact that we have a difficult time keeping a workforce in North Dakota, it was something that we had asked the federal government to consider.
In fact, Pritchett says several states have similar rules, like Minnesota. Minnesota also has an abuse list, but it is called the Nursing Assistant Registry. The registry is broken down into abuse, neglect, and misappropriation of funds. Their registry system is very similar to North Dakota's. The difference is how they categorize abuse, and that the public must call and submit a request for information on the registry. Aging Life Care Management Director Carmel Fromke says all nursing homes are supposed to consult the list as they hire staff.
You would be pretty safe. I don't think as a family you need to worry about that.
Pritchett says when he sends out an updated list, he often doesn't include the name added or removed, so facilities have to look through the list and check the names.
We do that to protect the vulnerable adults that are in the nursing homes. There's over 6,000 nursing home beds licensed as skilled beds in the state, and they contain our most vulnerable adult.
Federal laws state that the list is supposed to be checked once a year by facilities. Ashley Bishop, Valley News Live.